Hello, Internet. I am back with some thoughts I have on healthcare. We all need it, but it's kind of stupid. In Sweden, you get your healthcare from taxes. The regional politicians finance the projects that become the hospitals, no matter if it's in their own regime or a private company. This to me is borderline corruption, because you now have private companies that own the situation, but it's all tax funded. But the politicians really don't have any control over the regional organizations either, because the boss and the medical personnel working by education and systematic rules that are in place. Most of the people that have bad health and go to the hospital have many times themselves to blame for their health. They smoke, drink, do drugs. They only eat crap. They hurt themselves doing something dangerous or simply did not exercise for a prolonged functional life. And in Sweden, everyone that is working needs to pay for that with their taxes. Most are even fooled that they have paid in advance, so when their time to receive comes, they have paid for it in advance. And this is understandable, depending on how much taxes you have paid. Some people pay 55% taxes, some pay 33-ish% taxes, and others live their entire life on welfare. Now there's a portion of those that goes to the regional. So if you're a worker paying worker tax, the bigger portion goes to communal and region. So the communal and region split the bigger portion. Communal is the city. Region is a couple of cities that work together. Anyways, so it's not all of those. Some go to the state. But none of the taxes they have paid waits for them. It's spent on people at the time they paid taxes, not when they themselves need the service. Which also means it's a system that can fall flat, just like that. Which means you might pay for healthcare that's given to others, and in the future you might not get the same service. So that means you paid for someone's service today, and in the future there might not be a service for you. In Sweden, we don't really sue when we get injured from healthcare. We complain to a regional group that oversees the report of foul work in the healthcare system. But they have zero power over that organization. They can only slowly change it if they can. You can probably get some money from it, but it's not a lot. But you cannot fix people. Most of the time, you can only keep them alive. When they rehabilitate, you cannot work out for them. All surgeries carries risk of death or other complications that can lead to a lifelong handicap. Basically, if you get out of the hospital with a result that you are back to your regular self, you're almost lucky. Or you weren't that bad along. The ones that cost the most are also the ones that will never be saved from their condition. It's also very ungrateful to work within the healthcare. You can get blamed for everything that goes wrong. You might not have the personality for the work or the skill for the procedures. If you lose your job because you're bad at it, was it the education, or are you blamed for a situation out of your control? In some places you might even be sued. Not only that, the workload alone and the personal risk of yourself getting sick on the job. You might also end up hating yourself for things you did wrong by mistake. Guilt over trying to do good but failing. Worst part is all the courses you go in school that contradict each other, with theories that are counter opposite, and with a mentality that as long as you are trying to do good, that you are doing your best as forgiving factors. Almost making all the rules pointless, and everything goes. It's a bit crazy and way too expensive. But if you need it, and it saves some of the people that would have died anyway, maybe it's not the worst. Thanks for listening.